In this video, we're going to break down the basics of Medicare Advantage and Medigap coverage. That's big because you can't have both. Our goal is to give you a clearer understanding of the differences so that by the end of this video, you can decide which option is best for you. Let's dive in. Medigap insurance works alongside your original Medicare Part A and Part B coverage and simply helps fill in some of the gaps. It doesn't replace your original Medicare, it simply supplements your coverage, which is why it's also referred to as Medigap Supplement. It generally pays at least some of your Part A and Part B out-of-pocket costs. All plans usually cover your hospital inpatient costs for up to a year after your Medicare coverage runs out. All plans also cover at least 50% of these costs, and some cover 100% of doctor visits, hospice care, and blood. And some plans cover at least 50% of skilled nursing, Medicare Part A deductible, and emergency care overseas. Part B excess charges may be covered if you see a healthcare provider who's legally allowed to charge more than the Medicare-approved amount. You may get help paying your Part B deductible, but plans with this benefit aren't available to you unless you qualified for Medicare before 2020. A couple of the standard plans have out-of-pocket limits to protect you from high costs. These plans set a specified amount for Medicare-covered services during the year. If you reach that limit, the plan may pay any further costs for the rest of the year. Here are some other useful facts about Medigap insurance plans. In most states, each plan is named with a letter, and the basic benefits they offer are standardized. Take Medicare Supplement Plan G, for example. It will have the same basic benefits whether you live in Washington State or Florida. However, the monthly premiums can vary. Now, here is something important to know about applying because your timing on this could be critical. If you already have both Medicare Part A and Part B, your first opportunity to apply is during your Medigap open enrollment period, and it starts the first month that you are both age 65 or older and have Medicare Part B. Your OEP lasts for 6 months. In most cases, it's only if you apply during this time that your acceptance is guaranteed. You can apply at any other time later, but the plan might not have to accept your application. In some cases, they can charge you more or impose a waiting period if you have health conditions. There are some exceptions to this rule, but this is most likely the only time that your application will be guaranteed. Okay, that's what Medigap insurance is all about. Now let's talk about Medicare Advantage. As we briefly mentioned at the beginning of this video, original Medicare is offered by the government, and benefits are categorized into 2 parts. Part A, which are your hospital costs, and Part B, which includes doctor visits, lab tests, and other covered services. Medicare Advantage is also called Medicare Part C. It's an alternative way to get your original Medicare benefits, Part A and Part B, but through private Medicare-approved insurance companies rather than the government. With this type of plan, you're still enrolled in Medicare, but your Medicare Advantage plan and your primary care provider work together to coordinate your care. Here's a chart that lays out the pros and cons of these types of coverage. You might want to pause the video to take a closer look. Remember, you don't have to sign up for either of these, but you can't have both. You might be wondering, what if I decide to change my mind? Is my decision set in stone? Here's a quick rundown of when you can change from one type of coverage to the other. If you sign up for a Medicare Advantage plan and decide you'd rather return to original Medicare and supplement it with a Medigap plan, you have a few chances to do that. For example, suppose you signed up for Medicare Advantage when you first qualified for Medicare, but after a few months you decide a Medigap insurance plan would better fit your needs. If you've had the Medicare Advantage plan for 12 months or less, you qualify for a trial right. You can drop the Medicare Advantage plan, return to original Medicare, and buy a Medigap insurance plan. Without the trial right, though, you might not qualify for guaranteed issue rights for a Medigap insurance plan. If you don't qualify for the trial right, you can drop your Medicare Advantage plan during the Medicare Annual Enrollment Period, or AEP, from October 15th to December 7th. You can also drop a Medicare Advantage plan at these times. If you want to switch from a Medigap insurance plan and enroll in a Medicare Advantage plan, you can generally enroll only during certain times of the year. The main time period for this is the Medicare Annual Enrollment Period, October 15th to December 7th. So that's it. Now you know the basics of Medigap and Medicare Advantage. And if this has been helpful, go check out our extensive library of other videos to guide you through your Medicare journey. Take care.